Hi everyone, I am Dr. Srikanth Raju, Senior Consultant Vascular Endovascular Surgeon and Foot Care Specialist. Today I am here to discuss about one important topic, that is called deep vein thrombosis. What is deep vein thrombosis? It's nothing but if you have a blood clot formation in the veins in the leg, you call it as a deep vein thrombosis. There are two types of veins in our body, one which is superficial veins and the other one is deep veins. Deep veins run through the muscles in the leg and thigh region and enter into the abdomen, and they form IVC. In a way, they go up to the lungs, and where whatever the unpurified blood is there, deoxygenated blood is there, which is taken from the leg towards the heart and gets purified through arteries. Again, this blood comes down. If you have a blood clots in these deep veins, you call it as deep vein thrombosis. What are the causes of this deep vein thrombosis? Usually in general population also can have DVT. The usually age group can range between any people, and it is equally common in both male and females, and it usually occurs in a normal population also in those people who are having most of sedentary lifestyle. For example, if the patient doesn't walk for like a normal population, in such patients also they can have DVT. And patients who go for a long distance journeys, and for example people who have underwent a recent surgery like a knee surgery, hip surgery, orthopedic surgeries, or the female patient undergoing a cesarean section or a hysterectomy or post normal delivery or any other major abdominal surgeries, in those patients after the procedure, if they don't walk well and they don't ambulate, in such patients this deep veins undergo thrombosis because of decreased flow of blood from leg towards the heart. So these are normal in general conditions in which deep vein thrombosis can occur. And one more condition is something like a cancer patients can also have a DVT. The cancer patients, in them the cancerous cells have a prothrombotic nature. So they provoke more of thrombus formation. This is one way of forming thrombus in cancer patients. And the other way is if a patient is having a large tumor, which is a cancer which is there in the abdomen, compressing on the veins carrying blood towards the heart. In such situation also patients can have DVT. And apart from this, there are many other rare conditions like protein S and protein C deficiency, antithrombin 3 deficiency, factor V Leiden mutation, antiphospholipid antibody syndrome, hyperhomocysteine. These all are different blood conditions in which if those protein levels are not in a normal range in the human blood, they also provocate to have a thrombus formation. So if the patients having these genetic conditions leading to this thrombus formation, then in those patients we call it as unprovoked DVT. Unprovoked DVT means nothing but they are doing their activities physically active, but in spite of that, when these patients are having blood clots, you call it as an unprovoked DVT. And coming to this DVT, how we diagnose these things? The symptoms with this DVT is patients will have swelling in the leg, a pain in the leg, and sometimes if it progresses, the swelling might extend from the foot towards leg, towards thigh, extending into the abdomen. And sometimes this clot migrate from the leg towards lungs, and they get deposited in the blood tubes which carry blood towards the lungs, leading to pulmonary thromboembolism, causing patient to have a severe respiratory distress, having breathing difficulty, requiring high oxygen support, and sometimes they need a ventilatory support, and some situations they might go to such a situation where their life can be threatened. In such patients, in order to diagnose DVT, the one important diagnostic modality is venous Doppler. In that venous Doppler, we will be trying to see how are the deep veins, from where the thrombus has been formed, and it is extending up to what area. These basic informations we get through venous Doppler. Patients who have pulmonary thromboembolism, in such patients, to know abdominal extension and to know to what extent it has gone up to the lungs, we do CT pulmonary angiography and CT venogram of bilateral lower limbs to find out all these things. And if you like the content in this video, please like, share and subscribe my YouTube channel, that is Dr. Srikanth Raju. In next video, you will be knowing what are the treatment modalities which are available for the deep vein thrombosis.